Hello everyone, I am pleased to present my project titled Development and Evaluation of Topical Quercetin Loaded Bilosomal Gel Formulation for Psoriasis. So let's begin with an introduction. Psoriasis is non-contagious chronic autoimmune skin disease which cause hyperproliferation of keratinocytes in epidermis, in which the skin cells multiply 10 times faster than the normal skin cells, which ultimately results in the formation of plaques which are covered with a wide buildup of dead skins, which are often itchy and painful. The main cause of this disease is the immune system dysfunction. When it comes to the treatments, the conventional options have some drawbacks such as poor skin penetration, stains on the cloth, higher frequency of application, including some severe health problems. Quercetin is a bioflavonoid which is popularly known for its anti-inflammatory properties. As it is a BCS class 4 drug, it requires some carrier systems. So here I have used the bilosome. So bilosomes are nothing but the spherical unilamellar closed vesicle containing bile salts, lipids and non-ionic surfactant. So the innermost layer of the bilosomes contain the hydrophobic drug, whereas the outermost layer of the bilosome contains the bile salts. Bilosomes are actually the altered version of typical vesicular carrier. It contains bile salts. Bile salts are endogenous surfactant that present naturally in our body and are exceptionally biodegradable, biocompatible and have very less toxicity. Over the current vesicular drug delivery systems, biolosomes have a number of advantages, including high transdermal permeation, enhanced in vivo resistance, unique gastrointestinal stability, along with increased entrapment efficacy and sustained release. Moreover, it has the fluidizing effect that could improve the transdermal administration. The main rationale behind this project is to use the biosome to make drug dissolve better and pass through membrane more easily. This can help drugs release slowly over the period of time, making it easier for the patient to take them regularly. The main aim of this study was to develop, optimize, and evaluate the topical dosage form for the psoriasis treatment, and the objectives are as follows. To meet our objectives, we performed pre-formulation studies where we checked the solubility of our drug quercetin, did DSC analysis and FTIR test. All the results were similar to the standard quercetin, showing that our drug was pure and therapeutically effective. Now moving on to the methodology. So here I have used ethanol injection method. So first I dissolved lipids, surfactant and drug in ethanol and bile salts in water. So I prepared organic and aqueous phase separately. Then carefully I added organic phase into the aqueous phase in dropwise manner, like the speed was 20 drops per minute under the overhead stirrer for 2 hours. Then the bilosome dispersion was prepared. This bilosome dispersion was incorporated with the carbopol gel system, and our final formulation containing quercetin is prepared. So this is the quercetin loaded bilosomal gel. Next, the optimized batches were prepared for formulation of bilosome dispersion. Our surfactant was PAN 60, lipid was cholesterol, and the bile salt was sodium deoxycholate. In the pre-optimized batches, we selected the surfactant to lipid ratio as 7 is to 1, as it showed the better results over other ratios. Further, the concentration of bile salts and quercetin were optimized accordingly, which can be referred in this table. So B8 batch was selected as optimized batch due to its favorable characteristics, including achieving the lowest particle size among all the batches. Following the optimization, we performed the characterization of this bilosomal dispersion, including the particle size, PDI, entrapment efficacy, and zeta potential, and all the results were in the standard limits. The TAME studies, that is transmission electron microscopy, showed the results that the morphology of the particles was spherical and uniform distribution. It suggests that our formulation was stable and having uniform particle size. The bilosomal dispersion was then formulated in the gel using this optimized formula. For the comparison purpose, I have also prepared the conventional gel. In the conventional gel, I have used PEG 400 as surfactant instead of bile salt. Rest all ingredients were the same. So, the developed gels were inspected visually for its organoleptic properties, consistency, and homogeneity. The results were almost same for both the gels. The major difference was observed during the in vitro release studies. Both the gels were subjected to the diffusion studies using France diffusion cell. So in this we have two compartments. The first one is the donor compartment and the second one is the receptor compartment. In the receptor compartment we have filled the phosphate buffered saline of pH 6.8. In the donor compartment we have put our gel formulation. Between these two compartments we have a dialysis membrane of thickness 50 Daltons. So at regular interval of time, the samples were taken out of the receptor compartment to check the drug release. And in this graph, we can see that the blue line is of bilosomal dispersion, the orange line is of bilosomal gel, and the gray line represents the conventional gel. So from graph, it is observed that our bilosome gel is showing sustained release with 60% drug release over 24 hours, whereas the conventional gel was showing only 11.97%. Kinetic analysis was performed on the obtained release data, and the data was best fitted into the Higuchi model with the highest R square value, which indicating that our formulation has controlled diffusion release pattern. After studying how our formulation releases into the drug in laboratory condition, the next step was to check how well it penetrates through the skin. So we did ex vivo permeation study by using modified France diffusion cell by using pig ear skin. So the procedure was almost same as the in vitro release studies. So from the graph, we can understand that the release pattern of the bilosome gel was sustained release with 45.5% of drug release in 24 hours. We are now moving to the next and the main phase of the study, that is the in vivo anti-psoriatic study. These studies were conducted on 24 mice in 14-day experiment where the animals were divided into four groups. The first one was the normal control, the second one was the negative control, the third one was the quercetin bilosome gel, and the fourth one was the conventional gel. So psoriasis was induced in all groups except the normal group by using imiquid cream, and after the induction the treatments were started. The evaluation was done on the basis of three parameters. The first one was the psoriasis area severity index, where we considered three things. The first one is the erythema, the second one is the scaling, and the third one is the skin thickness. All factors were scored independently on a scale from 0 to 4, ranging from mild to very severe. The second one is the spleen wet measurement. The topical use of imiquid cream has been reported to increase the spleen wet, so we also recorded the spleen wet after the treatment was done. The third one was the histopathological examination. On the basis of all parameters, it can be observed that the treatment with the bilosomal formulation can significantly reduce the severity of psoriasis when compared with the negative and the conventional group. Next, to know the mechanism of action, we did the cell line studies by using human keratinocytes cells co-cultured with immune cells. So the first we did the MTT assay to check the cell viability. The second we checked the ROS scavenging activity to know about the antioxidant activity. And the third one is the RT-PCR for psoriasis marker to know about the anti-inflammatory activity. So to summarize, this study highlights the quercetin-loaded bilosomal gel formulation as a promising option. It shows strong anti-inflammatory and anti-psoriatic and powerful antioxidant properties and is biocompatible and biodegradable. This formulation represents an advance in topical treatments with the enhanced stability, controlled release, and potential for less frequent application, offering a benefits and improved patient compliance. Thank you.